So I talked about before, where is this pain coming from? We're talking about chronic pain and chronic fatigue. And the side effects I went through talking about opioids and NSAIDs, a lot of the things that are used for chronic pain especially. And I talked about their side effects. So what I'm talking about is how we can give support for that in other ways that don't lead to those side effects. And I was just telling them earlier, I really want individuals to understand what's causing this chronic inflammation that's leading to this pain. Well, it can be something like injury, but two of the areas that I talk about a lot and that I treat in my practice is the gut bacteria within your gastrointestinal tract. We have a lot of gut bacteria. I tell people all the time, we have 10 trillion cells in our body. Everybody knows we're mainly cells, but we have 100 trillion bacteria in our GI tract. So we're mostly bacteria. And the question is that mainly good bacteria or is that bad bacteria? And that depends on how we support it and what we feed it. And the other thing that's causing this inflammation is mitochondrial dysfunction. If there's one thing I want to give you homework for, it's know what your mitochondria is. Just look that up. Just look up mitochondrial function and mitochondrial dysfunction. And just see the things that it leads to, whether that's Parkinson's, depression, a lot of your neurological disorders, a bipolar disorder, ALS, myotrophic lateral sclerosis, which affects the motor neurons. But things, autoimmune diseases that cause inflammation, but then your cardiovascular diseases. Because we know our mitochondria, that leads to our energy production of our body. That's what gives us energy. It is our energy source. But if you look up mitochondria and you look up the conditions associated with mitochondrial dysfunction, you will be amazed. Like, I can't believe this. This is the source. This is what's going on.
Instead of us looking it up, or in addition to us looking it up, could you just explain what mitochondria is and does?
I will. Yep, absolutely. I got a picture of it too. Absolutely. So here, I told you about the gut bacteria in your GI tract. Well, that's what that picture represents right there. These cells right here, that represents the lining of your GI tract. And what it's showing right there is a break in that lining. And right underneath that lining, here is a lot of your immune system, a great majority of your immune system. The reason I show that is this causes a lot of our chronic inflammation right in our GI tract. What they call gut permeability or a leaky gut. Well, if that happens, and we get bacteria that gets within, breaks that lining, or undigested food particles, that's going to stimulate our immune system right there. A lot of our rheumatological conditions, rheumatoid arthritis, ankylosing spondylitis, they'll use what they call the Tnf-Alpha Inhibitors. Anybody ever heard of those? They're the biologics. Very powerful for taking down inflammation. And I show this picture because you can see right there, it's hard to see, but it's TNF-alpha. That's where that inflammation is being produced. That's where that TNF-alpha is being produced at the level of the GI tract. And I educate individuals all the time that we can suppress that TNF-alpha from attacking the joint and causing the pain, but it's being produced because there's damage to the lining of that GI tract. We have to heal that lining to stop that inflammation from being produced.
And how do we do that?
I'll show you. I'll show you some of those interventions that we can do. You go to the next. So that gut bacteria, so I showed you that lining. On top of that lining, that is the bacteria. It lies right on top of that lining I showed you. Well, it's made up of good and bad bacteria. Like I said before, we got to make sure the majority of that is good to keep that lining intact. Because when there's a majority of bad bacteria, that's what causes that break in that lining. So to your question, we got to make sure there's enough good bacteria to nourish that lining. That good bacteria, like it says here, produces vitamins, B12, K2, which are very, very important. It's very anti-inflammatory. So we're talking about inflammation leading to this pain. We need things that are anti-inflammatory. Well, that good bacteria is very, very anti-inflammatory. It nourishes that cell lining. It also modulates our immune system so it doesn't attack our joints. It keeps it in balance. It also produces neurotransmitters. You've probably heard that serotonin is implicated, a deficiency of serotonin is implicated in depression. So somebody given a medication so they have higher levels of serotonin, so they don't have that depression. The thing is over 90% of that serotonin is produced in our gut, in our GI tract. So you can see how important it is, even a neurological condition like depression, we have got to support our gut, our GI tract. We got to nourish that with good bacteria. Hormones, also, a lot of hormones are produced in our GI tract. Very important. People will come to me all the time and they'll say, well, my hormones are out of balance. And I'll say, well, let's look at your digestive health. Let's look at your gut health. Like, well, what's that have to do with my hormones being out of balance? And I'll say everything. Because there's so many of your hormones are produced there. So you can see neurotransmitters like serotonin, for neurological conditions, and then hormones are all produced in our GI tract. Very, very important. This is just a picture here, what I was talking about, how that gut bacteria keeps your immune system in the balance. So you ask, how can we nourish that lining? How can we make it strong? How can we make it intact so it doesn't have that break, so it's not leaky? Well, nutritional medicine is one of the mainstays of my practice. And it's feeding it the foods that are going to feed the good bacteria. Of course, that is a lot of our vegetables, no doubt about it. They feed the good bacteria, they help them reproduce. What's going to feed the bad bacteria? Number one is sugar. There's no doubt about it. That's why you're hearing all the time, man, sugar is bad, it causes inflammation, obesity, diabetes, and it's true. The sugar, and one of the main reasons is that sugar is fuel for that bad bacteria in your GI tract. The bad bacteria grows, it damages that lining, it disrupts the immune system. The immune system attacks different organs in different people. Some people, that can be brain tissue, so we get neurological conditions. Some people, that might be the joint, and that's where we can get our arthritis, our rheumatoid arthritis, and different inflammatory conditions that are attacking us at the level of the joint. But I'm showing you what's the source of this, though. What's producing this inflammation? It is at the gut. And it's what we're feeding that bacteria. Are we feeding the bad? Or are we feeding the good? L-glutamine is great. I use that a lot because it's one of the main fuel sources. You remember that when I showed you the lining of the GI tract and those cells? Well, L-glutamine is the main fuel source for those cells. If they don't have their main fuel, enough L-glutamine, then again, they're going to break down. There's going to be a break in that lining. They must have their main fuel source. That's why L-glutamine is so popular for GI conditions to heal that gut lining. Botanical demulcents, there's different things. You might have heard of DGL, aloe vera, marshmallow, not the marshmallow you're thinking of, not the one you roast on the campfire, but it's a botanical demulcent. And vitamin A and zinc carnosine, again, because they help those cells lining that GI tract, they help them stay tight and together. Because again, we don't want to break there. All of those help those junctions stay so there's not a break, so it doesn't let that pathogenic bacteria and undigested food particles in to stimulate the immune system.